Akram, Vice Chancellor of the University of Health Sciences, to arrive in his desk and take his position as our keynote speaker. While Sir is here, Sir, most welcome, and very warm welcome and good morning to Professor Javed Akram, who is currently serving as the Vice Chancellor, University of Health Sciences, and he is the founding president of Pakistan's Faculty of Internal Medicine. Professor Javed Akram has a rich history of leading large public sector organizations and educational institutions when it comes to medical universities. He was the founding Vice Chancellor of Medical University. He served as Chief Executive of Jinnah Hospital and Allahabad Medical College. So currently, as I said, he is the Vice Chancellor of the University of Health Sciences. Sir, over to you for your insights into the challenges and opportunities offered during this pandemic.
Right. Bismillahirrahmanirrahim. I hope everybody can hear me, and I'm very, very grateful to Professor Fatima Mukhtar, Head of the Public Health Department at UHS, for the opportunity. And I wish everybody a very happy Immunization Day. So I was asked to talk a little bit about my experience of vaccination or inoculation or immunization. Obviously, these are words which are interchangeable. So I will very briefly talk about mostly about the challenges and opportunities, and then local perspective. I'll be giving a little bit of the background of what I think about vaccination. Of course, people, I'm not lucky enough to be belonging to public health side. I am a doctor working on the curative side. So much more opportunity for you people to prevent or cure millions, and I have only opportunity to cure a few. But anyhow, whatever little I know of about the vaccination, I'll try my best to share with you, because you are the masters in this. I'll talk about a little bit about facts and the evidence that we have, and then what are the challenges, local challenges in immunization, and how the COVID vaccine so far is done in Pakistan, and then I'll conclude. Vaccine, we all know, are products which stimulate a person's immune system to produce immunity to a specific disease, protecting that person from the disease. But I think also more importantly, if it doesn't successfully protect that person, it has an ability to protect the whole community or the nation or even the world. We have an example of smallpox, and we have a very good example of OPV, oral polio vaccine. We know that once the herd immunity is created, then the transmission stops, and then even people who have not been vaccinated due to some reason, either they are small infants or pregnant ladies or people suffering from various comorbidities like cancer who cannot be vaccinated, they still enjoy this herd immunity. But remember, to create this herd immunity, we generally would like 80% of the population of the world to be immunized effectively and or of the population. What is important is there are different types of vaccines, either killed virus or weakened virus, attenuated virus, or a part of the virus, what we call subunit vaccine, or a message given to the cells to generate a genetic material embedded on a protein given to a person, and the message is really to produce an antigen within the body, what we call autologous antigen process, initiate that, and then the antibodies follow that. Uh, we can give a vaccine by injections most commonly, but also by oral route and by nasal route. And now we are also looking at vaccines all over the world, which can be given through the dermal route. We know vaccines for a very, very long time, since 1796, when the smallpox vaccine was uh, invented by Edward Jenner, and then the tetanus, then MMR, DPT, and so on. Normally, we all know that a vaccine development process is about 12 years or so, because there are preclinical studies in the lab, then there are animal studies, then they enter a small group of volunteers, maybe 50 to 100 in phase 1. And once that is cleared, at every stage the results are analyzed, and then you apply to your local institutional review board or national bioethics committee, and then only you are given permission for the next to go into the next phase. So it is all normally happens in a linear fashion, and then you're looking at the infrastructure, the commercialization takes place, the manufacturing, and then registration of, and then the distribution, which is phase 4 trial. While in COVID-19, obviously there is no time when you are, I call it third world war, because about 4 million people have died so far of this disease. So in every hour, about 6 to 8 people are dying within Pakistan, at least reported, and there are many, many unreported cases. And in the world, about more than 300 people are dying. So obviously, we have no time, so everything is happening in parallel. We are not analyzing the results of the preclinical studies and then going into phase 1, or similarly in analyzing phase 2 trial and then allowing phase 3. Here we are allowing in as an emergency approval for the trials. We are doing it in parallel, and that is why in about 8 to 9 months we had about 112 vaccines. Here, vaccines have prevented so far more than at least 20 life-threatening diseases in people of all ages and all sexes. Immunization, it is estimated, prevents about more than 3 million deaths every year. And this figure is likely to increase once we add the COVID vaccination. We do not know how much prevention that is going to confer, but we are contemplating that this figure might double within the next year or so. Immunization is one of the best investments for parents who can make for their children, and also for a nation who can make for their population. 20 million infants each year, unfortunately, still today have insufficient access to vaccines. The people ask me which vaccine they should take. My answer is whichever vaccine you can get a hand on, and as early as possible, get yourself vaccinated for COVID-19. In February of this year, 7 different vaccines across 3 platforms were rolled out in different countries. Now, at least more than 200 additional vaccine candidates are in development. And we think by the June, we'll have about 400 plus vaccines either entering phase 2 or phase 3 trial. You can have whole virus vaccine, as I discussed, make the virus inactive or make it dead, and then use that as a protein, the entire virus. But more, I think, popular viruses are subunit virus. What we call is golf tea, because as you can see, they look like golf tea. We call them golf tea vaccine. 3 vaccines from China, 2 from Russia are now entering phase 3 trials of protein subunit vaccine. When you talk of COVID protein subunit vaccines, because we know hepatitis B, we know pneumococcal vaccines, they are also subunit vaccines. But in COVID-19, it is the spike proteins, glycoprotein S. It is that domain that matters, because we know that this Golf T is very, very important for the virus, because only by this mechanism, attachment of this to ACE2 receptor, the virus in the bronchoalveolar tree can enter the human body and play havoc there with the pneumocytes and then with the whole entire body. Then we have viral vector vaccines, where a virus which is not harmful to the human body. It has been used as a platform, and then you added some genetic material to it from the COVID-19 virus, RNA virus, and then you inject it. So these are very, very popular vaccines, and CanSino vaccine is one of these. Of course, again, we are doing a trial on ZF 2001, which is not a viral vector. There, a platform has been used by Chinese hamster ovarian cell. So it was the same thing has been done, rather doing on the innocent virus. We have done it on a ovarian cell. So, and also many vaccines are coming in, which are another vaccine that we are going to start a trial is Volvac, and Volvac is a insect-based vaccine. Similarly, Nick Petrosky, who is the principal investigator of an Australian vaccine, they also have a insect-based vaccine. Then the most modern one, we know this technology, messenger RNA, messenger DNA technology from anti-cancer drugs. But for the first time in the history of the world, this technology has been used in vaccine development, and this has happened in the COVID-19 vaccine quite successfully. Here we just take an RNA material and embed it with a message, a genetic message that your immune cells, the B cells and T cells, produce an antigen, which is a glycoprotein S. So glycoprotein S, once formed by your own cells, you don't inject them from outside, they are produced, and then your body reacts by producing antibodies against it. So once the antibodies are produced, then this vaccine in few hours goes out of your system. So the advantage is that it just does not have any long-term side effect, because it goes out of your body within 24 hours after imparting that message to your immune cells. The intracellular transmission of the message is very, very rapid, but the problem is they do require certain cold chain facilities, depending upon Pfizer, we know it -68, Moderna, we know -18 still, which are difficult and challenging in countries like Pakistan. Whichever vaccine you look at, whether you're looking at whole virus subunit vaccine, vector-based vaccine, or you're looking at messenger RNA, they all act in this domain. Because this is a viral membrane, and this is the receptor binding domain of the virus. And here, through this RBD, it attaches to ACE2 receptors. We know that ACE2 receptors in children are immature, so that is why they were not getting that much disease, because the virus was unable to attach to immature ACE2 receptors. But no more. Virus has mutated, and there are a lot of variations in glycoprotein S. So now even children are not spared. And so the major target for all the neutralizing antibody is receptor binding domain. Remember, we are not targeting the virus, we are targeting only the assembly system of the virus to the ACE2 receptor. This trial, this slide tells us that how much disparity exists between the vaccines. Of course, this is Africa, this is the US, this is again Europe, you can see, and this is India, which is one of the largest producers in the world because of the Vaccine Institute. About for 4 million doses a day. Just one institute of theirs is developing. They also have messenger RNA vaccine. But still, disease is playing havoc there. And here is Pakistan. The lighter the color, the less the per 100 population vaccinated. And in Pakistan, so far, about less than about 1 million people only have been vaccinated in a country of 220 million. So that is why you see the lighter shade. While you can see in Europe, in UK, and Canada, in US and Australia, of course, they are getting reasonably dark figures. So this highlights the disparity. 5 vaccines have been approved so far in Pakistan. CanSino, the one we tried with 18,000 volunteers. Gamaleya, Sputnik 5, Oxford, AstraZeneca. Unfortunately, we all know that this has been halted by regulatory bodies because of what we call a side effect. This and Johnson & Johnson single-dose vaccine, both have been halted, so paused so far, because they cause a mysterious syndrome called thrombotic thrombocytopenic thrombosis. Immune-mediated thrombotic thrombocytopenia. So there is loss of platelets, and there are platelet hyperactivity syndrome, and thrombosis occurs in different vascular beds. Sinopharm from Beijing Institute of Biotechnology, which was given as a gift and now being procured, and then the Sinovac. Again, this is a whole virus vaccine. This is we know that vector-based vaccine. This is a vector-based vaccine, and this, of course, developed by Sarah Gilbert at this again a recombinant vaccine. EPI in Pakistan is operational since 1976. Unfortunately, not a lot of research papers haven't come up from EPI. I wish people were studying it and people were writing about it. So that created, because the evidence haven't been reproduced, so a lot of misperception. And the Osama bin Laden was traced through a vaccination program, and that also did no good to our vaccination program, because people think that through vaccines something is embedded and people can trace them through satellites or whatever, which of course is fiction and not a fact. There was no academics into the API. Okay, there was no training mechanism. It should have been an autonomous body with an academic body, a university behind them, so industrial linkages, academia industrial linkages could be exploited. Resource constraints, and also I think the mindset of the people of Pakistan could not be changed adequately. And of course, Pakistan perhaps is one of the few countries where there is not a single biotechnology plant is available. We have developed many biotechnology products during my tenure in the labs. We have researched them. We have done phase 1 trials, phase 2 trials, phase 3 trials. But obviously, this is not the job of the university to put up a biotechnology plant. Neither it's of the government, it's a private entrepreneur. Of course, government and university can support them. I tried my best, but so far failed that we must have biotechnology plants around Pakistan. India next door has about 300 plants. China has 2,500 plants by now. If you look at COVID-19 vaccination, we probably are one of those countries, as I showed, which have the lowest vaccination rate so far. We are relying totally on either donations or imports, and queuing occurs everywhere. Everywhere it is a queuing phenomenon, but unfortunately, we entered this queue very late, so we are really almost exclusively all the vaccines are coming from China with this. We have very limited efficacy data in our population. obviously different population behaves to vaccines differently. So imperative, so we do the trials in our population, and very few trials are being done, and because the international linkages are missing. Absence of reference lab and quality assurance mechanism. People claim that their vaccine is stable at 2 to 8, but we have no way that before injecting how effective the cold chain was. So it's not possible in Pakistan to check the efficacy of a vaccine or check the cold chain. Uh, Again, cold chain is a big challenge. Government is, of course, trying its best to improve the supply chain, but they should at the same time improve the logistics. Procuring vaccine is one thing, but injecting it safely and following up it to different areas of the country is another thing. Creating dashboards and the mechanism is not clear because the health has been devolved by 18th Amendment, and so every I think province is looking at things differently. There is no one body which is regulating the whole thing. So I think good nations, good institutes, good scientists are those, and they will be remembered in the history, who converted this challenge, this threat to the life in the form of COVID-19 into opportunity for themselves, their organizations, and the country. And I think for the first time in the history of Pakistan, uh, our country entered into trials of vaccines because of COVID-19. And I'm very grateful to my team, Shanur, his team, and also my other centers, because I'm PI of most of these vaccine trials. So we have about 10, 13 centers around Pakistan. I'm very grateful for the support and for the confidence in me and my team. And I'm most of all, I'm grateful to my volunteers who trusted me and my team and who came forward. And remember, our volunteers include our Chancellor, the Governor of Punjab, his family, his wife, and the corps commanders, the top. And I mean, it doesn't matter. Everybody is equally important for us, but that created a stimulus for public to follow once they volunteered themselves just as an ordinary person. Then it gave so much confidence to the public to come forward and volunteer and get themselves injected. The literacy, we all know, is something that we cannot be proud of in Pakistan. So we need to persuade people, spend a lot of time in counseling, and then following. They get the vaccine once they know that we are not going to disown them after giving the vaccine. And that is the challenge. And that is why once they enter a vaccination program, then they convince others to come in. Cross-cultural bridges are very important, and develop partnerships. We have developed so much international partnership. Many Chinese friends who have become a family to us, starting from CanSino family, ZF 2001, Livion family. You know, they are part and parcel of us now. So vaccines are well known, and they have really brought communities together, and that is asset for us, these memories. We always remember what we have done in the vaccine trial. This is a legacy, hopefully me and my team is going to leave behind. So local participation, we actively pursued the chambers of commerces. I went myself and with Shanur and with my team to different chambers, Gujranwala, Lahore, Sialkot, had MOUs with them. I went to many industries. We went to many organizations, banks, things like that, motivated them to come forward and volunteer. And that is why I think we are getting respectable numbers at UHS, while others still struggle. Very important. We, as I told you, we are unfortunately, Pakistan is not on the darker side of the map where we vaccine per 100 people. But I'm very proud to say that Pakistan is on the vaccine trial map, as you can see. Of course, other countries are there, but important for me is that Pakistan is there with at least 6 trials coming up, 2 already there, CanSino ZF 2001. And you can see it's not many countries who are taking the trial. As you can see, Canada only doing 1 trial. We are now entering about 5 trials. So we are not doing bad as far as research is concerned in vaccine. Of course, we need to increase our vaccination rates now. CanSino, we did phase 3 trial. And we know that we are following up these patients for 1 year. And as I told you, it's a adenovirus 5 based vaccine. 18,000 vaccinated, double-blind placebo-controlled trial. I'll share with you the results. Again, ZF 2001, Chinese hamster ovarian cell-based vaccine. Again, we have already done 1,000, and inshallah, very soon we will reach our 3,000 mark. And I'm looking after other centers, and this is being done in Uzbekistan also. Then we are also starting a trial by Volvax, which is the first, which will be the first messenger RNA vaccine coming to Pakistan as a trial. And this has been developed by Volvax in China. The good thing is that although it's a messenger RNA, but its cold chain is 2 to 8 only. So we are looking at many other vaccines, recombinant vaccine by Levizon, which will be started very, very soon. CanSino, as you can see, was effective in the global data in prevention of disease about 65% and about 90% preventing the serious disease. But in Pakistan, very, very important. In Pakistan, it prevented 100%. In 100% of the people injected with this vaccine, CanSino, we prevented serious disease, death, time to ventilator, time to oxygenation, and so on. And in about 75% prevention of the disease transmission altogether. Few snaps from these memory lane. Of course, they are our assets. These things we makeshift. Our examination center was converted into vaccination center, and you can see one of the legendary journalists taking the vaccine, Rana Azim Saab over here, my friend, just to give him confidence. Me and my team, international team standing there. Yang is there. So these are very, very good times that we'll never ever be able to forget. Again, we celebrated our completion of CanSino over here, and you can see the Chinese team and local team, all of them standing, and this guest room called Isagdar building was converted into a trial center, and I'm very grateful to Anhui, the owners of ZF 2001, for donating us a building now. They have donated UHS an entire building for vaccination trials. Again, you can see this is the Director General being injected, and this is a research. I've written more than 3 editorials and published more than 9 publications so far. This is one of the good ones. I'll encourage you. It is available online from European Review for Medical and Pharmacological Sciences. This is a meta-analysis of the vaccines available and would be good. I'll conclude at the end by saying that no vaccine so far is 100% effective against COVID. So even if you are vaccinated, you'll have to continue with precaution. FDA has granted emergency use authorization for vaccines, and so has our draft. Vaccines are beneficial to provide immunity against COVID-19 infection. It protects the recipients from the infection by formation of antibodies and provide immunity against SARS-CoV-2, hoping that is covering all the mutations. Of course, we are now testing the subgroups where we will be more confident that it is covering a double mutant strain of India and also UK strain, B117, and also South African strain, which is prevalent in Pakistan. All vaccines work in receptor binding domains and efficacy falls over time. So there is no magic pill that once you take a vaccine for a whole life. No, you need a booster now and then. Vaccines may cause disease, minor, but it will remain minor. So vaccine, number one, can prevent disease in some people, but in majority of the people, it will prevent severe disease. It will not prevent disease. That's important. And that's a good enough dividend that we can expect from a vaccine. Vaccine hesitancy remains prevalent even in healthcare providers, and this is due to misperceptions which we continuously try to dispel on media. CanSino vaccine, regional specific data showed 100% efficacy in preventing severe disease, 75% preventing symptomatic disease. ZF 2001, we do not know, it's a triple dose vaccine. CanSino was single dose vaccine. We don't know the efficacy, we don't have that data, but we know that it is in the more than 2,000 patients that are being vaccinated. It is shown a good tolerance. I thank you very much and I wish everybody a very, very safe.